In 15 minutes, a person who couldn't make out their alarm clock without glasses for 20 years gets up from the table and sees the clock on the wall, clearly, on their own. No lenses, no frames, nothing. It sounds like an advertisement, but behind those 15 minutes stands technology of such precision that the human eye cannot replicate it. A laser that works faster than you can blink, that tracks microscopic eye movements 1,000 times per second, that removes layers of tissue thinner than a fraction of a human hair. And yet, most people who think about the surgery imagine it completely wrong. Some fear they'll cut with a scalpel. Some think you have to lie motionless for an hour. Some are certain it's painful. Today I'll tell you what actually happens during femtoLASIK, step by step. What the person feels, what the surgeon does, what the laser does, without embellishment and without scare tactics, just as it is. To understand femtoLASIK, you first need to understand regular LASIK. LASIK is a method of laser correction in which a thin surface flap of the cornea is first created, lifted aside, the laser treats the inner layers, giving the cornea the needed shape, and then the flap is returned to its place. It adheres naturally, without stitches. The question is how this flap is created. In classic LASIK, it was made with a mechanical instrument, a microkeratome, essentially a very precise blade. This worked, but had its own limitations and risks associated with mechanical action. In femtoLASIK, the flap is created not with a blade, but with a femtosecond laser, hence the name, femto, from femtosecond, a unit of time equal to 1/4,000,000th of a second, an inconceivably short pulse. This laser works completely differently. It doesn't cut in the usual sense. It focuses inside the cornea at the required depth and creates millions of microscopic gas bubbles there, which form an even plane of separation. These bubbles line up in a perfect line, forming a flap of precise thickness and shape. No mechanical blade, only light, focused with incredible precision. The advantages are clear. Flap thickness is controlled far more precisely. The separation surface is more even, less dependence on mechanical factors, and importantly for the patient, the procedure is more predictable. FemtoLASIK is a powerful method, but it isn't universal, and understanding the indications is part of an honest conversation. The method is used for nearsightedness, farsightedness, and astigmatism within certain ranges. It suits people from 18 to 20 years of age, once vision has stabilized, meaning the diopters aren't changing year to year. The key condition is sufficient corneal thickness. Since the laser removes part of the tissue, the cornea must be thick enough that a safe margin remains after surgery. This is checked during diagnostics, thickness is measured, and a corneal map is built. FemtoLASIK isn't suitable in a number of conditions: with too thin a cornea, with keratoconus, a disease in which the cornea is thinned and deformed, with unstable vision when diopters keep changing, with certain eye diseases and systemic autoimmune conditions, during pregnancy and breastfeeding due to hormonal changes affecting the cornea. This is exactly why preoperative diagnostics isn't a formality, but a decisive stage. The surgeon must be confident the method is safe and suitable for the specific person. If femtoLASIK doesn't fit, it isn't a dead end. Other methods exist. Smile Pro, ICL lenses. One method is closed, another may be open. Preparation begins long before the procedure itself. The main condition is giving up contact lenses in advance. Soft lenses are removed several days before diagnostics and surgery, rigid ones 2 to 3 weeks before. The reason is that lenses temporarily change the shape of the cornea, and for measurements to be accurate, the cornea must return to its natural state. Before surgery, full diagnostics is performed. Visual acuity, refraction, corneal thickness are measured. A topographic map is built, and the condition of the retina and intraocular pressure are checked. Based on this data, the surgeon plans the operation, calculates how much tissue to remove and what shape of flap to create. On the day of surgery, it's recommended to arrive without eye makeup, without perfume or aerosols. Bring sunglasses because the eyes will be light sensitive after surgery, and it's advisable for someone to accompany you home, since immediately after the procedure, vision isn't yet fully clear. Now the most important part, what happens on the operating table. First, anesthetic drops are applied to the eye. This completely numbs the surface of the eye. No injections, no general anesthesia. The person is conscious, hears everything, and can follow simple requests from the surgeon. The anesthesia takes effect within a few minutes. Then a special device is placed, a lid speculum, which gently holds the eyelids open. This is needed so the person doesn't blink during the procedure. It sounds unpleasant, but thanks to the anesthesia, it causes no pain, only a light sensation of pressure. The first stage, creating the flap with the femtosecond laser. The eye is fixed, and the laser forms that flap in mere seconds using microbubbles. At this moment, the person may feel light pressure and see the image briefly dim. This is normal and lasts very briefly. The second stage, the surgeon carefully lifts the formed flap. The inner surface of the cornea is exposed. The third stage, the main one. The excimer laser is activated, evaporating microscopic layers of tissue and giving the cornea a new shape. It's this new shape that ensures proper focusing of light. This stage usually takes a few dozen seconds per eye. During this time, the person is asked to look at a special point. If the eye involuntarily moves, the tracking system instantly detects it and corrects the beam's position, hundreds of times per second. If movement goes beyond the limits, the laser automatically pauses. The fourth stage, the surgeon returns the flap to its place. It adheres naturally and fixes without stitches, thanks to the tissue's own properties. And that's it. Then the same is repeated with the second eye. The entire procedure on both eyes usually takes about 15 minutes, with the actual laser treatment being only a small part of that time. This is the question that concerns everyone. Let's be honest, during the surgery there is no pain, the anesthesia works. There's a sensation of pressure, especially during the flap creation stage. There's a moment when the image dims. There are unfamiliar sensations from the eye being held fixed, but pain itself, there is none. After the surgery, when the anesthesia wears off, discomfort is possible for several hours. Mild burning, a gritty feeling, watering, light sensitivity. This is a normal reaction of the eye. During this period, it's recommended to rest with the eyes closed, not rub them, and use the prescribed drops. By evening or the next morning, it usually becomes significantly easier. Many patients already see well the next day. Recovery after femtolasic is usually fast, but requires following the rules. The day after surgery, a mandatory follow-up examination. The surgeon checks how the flap adhered and how the cornea is healing. Most patients already see well, although vision may not yet be final. In the first days, it's important to follow several rules. Don't rub the eyes. This is the most important, because the flap is still adhering. Use the prescribed drops strictly on schedule. Avoid getting water in the eyes. Don't visit pools or saunas. Wear sunglasses outdoors. Limit eye strain in the first days. Final visual acuity establishes itself over several weeks as full healing occurs. During this period, scheduled examinations are conducted to monitor the process. It's important to understand, regular examinations after surgery aren't a sign that something is going wrong. They are a normal part of the process that allows confirmation that healing is proceeding correctly. After laser, vision will return to being poor over time. The laser changes the shape of the cornea permanently. It's a lasting change, but with age, presbyopia may develop, an age-related change in the lens, unrelated to the surgery. This is a separate process that happens to all people. It's painful and frightening. During the surgery, there's no pain thanks to anesthesia. Discomfort afterward is short-lived. Most people describe the experience as much simpler than they expected. You can go blind from such surgery. Femtolasic is one of the most refined and studied procedures. Serious complications are extremely rare. This is exactly why thorough patient selection exists, to exclude those for whom the method isn't suitable. After surgery, you won't be able to strain your eyes or do sports. After the recovery period, a person returns to normal life. Timelines for returning to sports and strain are discussed individually with the surgeon. Femtolasik is worth considering if you're tired of glasses and lenses, if they interfere with your lifestyle, work or sports. If you're over 18 to 20 years old and your vision has been stable for the last year or two, you're a potential candidate. But the first step is always not surgery, but diagnostics. Only after a full examination can it be said whether this method suits you and which correction option would be optimal. Femtolasik isn't magic, but a high-precision technology that for many people becomes an opportunity to live without glasses and lenses. It's a safe and predictable procedure for those it suits. But it's a medical intervention and it should be approached consciously. Not because you saw an advertisement or a friend was satisfied, but because you had diagnostics, understood your situation, and made the decision together with a doctor who assessed all the parameters of your specific eye. If you're thinking about laser correction and want to know whether Femtolasik suits you, start with diagnostics. At Ko'z Nuri Clinic, we conduct a complete preoperative examination. We measure corneal thickness and topography, check all necessary parameters. After the examination, you'll get a clear answer whether this method suits you, and if not, what alternatives exist. No pressure, only professional assessment. Contact details and booking are in the description below.